I am here attending from South Lyon, Michigan.
Markham? I'm here in Novi, Michigan. Cavell?
Here in Ferndale.
Spiz?
Present, Auburn Hills, Michigan.
And Miller.
Here in Farmington.
Thank you. We have a quorum.
All right, so we'll stand for the pledge. See Commissioner Whitebrad has the American flag there. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. So now we will we'll go. So we have to approval of the minutes. So we have 2 minutes approval. We'll do the first one was the January 13 minutes. We need a motion for that. It's been moved by Commissioner. What's that?
You can do them both at the same time.
Oh, we can do both. Say okay. Well, we'll start over. We'll do both at the same time. I see as Commissioner Spiz still want to move it, and seconded by Commissioner Charles. All right. So all in favor? I think we just do a voice vote. Yeah. All in favor, say aye.
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 Opposed? Ayes have it. Thank you. And now we have the approval of the agenda. Do we have any motion, any comments? Moved by Commissioner Charles, seconded by Commissioner Cavell. And then so that we would do all in favor, say aye.
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 Opposed? Ayes have it. All right. So now we will move to the consent agenda. Well, I'm sorry. Let me back up because I missed this one last time. We'll do public comment first. Is there any public comment?
Good morning. Currently, there's no one in the committee room A or the auditorium that would like to speak, and there are no written submissions, and there are no online callers. So there's no public comment this morning.
Thank you very much.
You're welcome.
Now we'll move to the consent agenda. We have the Board of Commissioners Tri-Party Road Improvement Program, fiscal year 2021 appropriations, City of Auburn Hills, traffic signal upgrade work and installation of pedestrian crossing on Baldwin Road, adjacent to Great Lakes Crossing, project number 55911. Report to the board. Need a motion. It's been moved by Commissioner Charles, seconded by Commissioner Markham. Voice vote on this. All in favor, say aye. Aye.
Aye.
Opposed?
Aye.
All right. Ayes have it. So now we'll move to the regular agenda. The first item on our regular agenda is the COVID and vaccination update. There she is.
There I am. Good morning.
Good morning.
All right. Good morning, everyone. So just a quick update, and then I can take questions if I don't touch on maybe a question you have right now. So to date, we have received 41,000 vaccines. That's both Moderna and Pfizer at this point. Through yesterday, we've administered close to 34,000 of those vaccines. Now, a common question we have is, okay, now you have maybe 7,000 outstanding vaccines. What are you doing with those? And so all of those vaccines have appointments attached to them. So what we do is as we receive our allocation, we generally get our numbers on Fridays. We actually receive our vaccine on Mondays or Tuesdays, depending on when the manufacturer ships them. We go in and build appointments based on the allocation that we receive. So because we don't know if we're going to get Pfizer or Moderna, it's very hard for us to preset and schedule appointments because the second dose timing is different. So for Pfizer, it is 3 weeks. Moderna, it is 4 weeks. And so it's very hard for us to try to schedule out way in advance because we don't know what the manufacturer is that we're going to receive. So we start on Friday, we send out invitations over the weekend, and then throughout the week, continue to invite anyone that's on our Save the Spot list. in those priority groups and invite them through email, or we may call them if they have indicated they don't have an email, and we schedule that appointment for them. We have multiple sites, so we're trying to move our drive-throughs indoors. This week has really posed some problems just with it being so cold. And it's not our employees, they're out there, ready to do the work. It's really just about the vaccine because it needs to stay stable at a certain temperature. And so it adds some challenges when we do the drive-throughs. We figure it out, right? We're running a lot of vaccine inside and out, which is great, but it does seem to work better with these really cold temperatures to be indoors. So that's kind of a little bit about the vaccine and how we schedule. This week, knowing, we've been talking about this for a while, but really knowing that over the next few weeks, as vaccine continues to increase, doses received by Oakland County Health Division through the local health department, is we need to create a network of providers that can really help us push this vaccine out to the priority groups. Everyone is working through that priority group that the health division is also working through. And so this week we reached out to pharmacies and hospitals that are interested in, growing our infrastructure and our network here so that we can provide vaccines, very easily to people. And no matter where they live, they work, it just makes it easier the more providers that we have. So we started that this week. So we were able to receive the vaccine allocation, and actually, if they're a certified provider through the state, they actually will receive the vaccine through us. They'll do first and second doses, and they will focus on those priority groups that we are focusing on. The other question we get a lot is Save Your Spot. And I know many of you have been asked by your constituents, can you find out where I am on the list of Save Your Spot? And so I wanted to just offer a couple of options for you, kind of to talk about, and then talk about what we did on Friday, and I will make sure you get a copy of this. There's kind of been two questions. I don't know if I'm on the list because early on, there was a message when they completed the survey that said, you're confirmed, you have a spot, but there was not a follow-up email. And so that brought a little bit of confusion for people. So we added in the confirmation so that people know now that they actually received it. Well, what we did Friday, because we have received quite a few questions, is we sent an extra correspondence to everyone that was on Save the Spot. And that's what I will share with everyone. I'll actually send it to Barbara Winters, and she usually does a great job about pushing it out to all of you. That said, if you're getting this message, you're on the Save the Spot list. There was more text there, but it kind of helps, reiterate that they are on the list, right? And that they're good to go. They don't have to call, to find out if they are. That means they're on the list. The other thing people want to know is, what's my number, right? So am I 20? Am I 20,000? Am I 350,000, right? And so it's very, that's another thing that poses a challenge, because what we have people do is they've kind of used it as a lottery system and you entered, their name in multiple times. So if I was to tell, you that you're 20,000th on the list, that doesn't mean you're not going to get called next week, right? So I think the message is best that if you've gotten the message that says you're on the Save the Spot, based on your priority group, you will either be called or emailed, or maybe both. So our process is we'll email, right? We send out the invitation. If someone doesn't have an email, we'll call them as their initial. And this weekend, we added a new step where we did kind of a robocall and a text to say, hey, you've been invited to get your COVID vaccine. Go in, try to find your invitation. When I say try, we have seen that many invitations, or some, not many, but there's certain email groups like Gmail and Yahoo that it may go into junk mail or promotional email. And so we're trying to reiterate that message and let people know to go look there periodically. So again, that's why we're trying to call, right, people. The other thing we do is if they haven't opened the email, because we have the technology to be able to see that, we're doing a follow-up call to them to say, we have we noticed that you have not opened your email, but we want to let you know you've been invited. We don't want people to miss their opportunity, when it's their turn and they're called. So we're really trying to do everything possible to let them know that this invitation has occurred and that we want to follow up with them and call them and that we see that has helped a lot by calling people and letting them know that it's in their email. So those are kind of the big things with vaccine right now. Another question we get, do we anticipate that the vaccine supply is going to increase? At this point, we're kind of hearing what we've received over the last couple of weeks will probably be our allocation for some time. We do know that the Johnson & Johnson vaccine is at the spot where they're going to start reviewing it for that emergency authorization use at the end of this month. And I know they have millions of doses ready to be distributed. So obviously that could also be a game changer for, vaccine quantity. And we also know that the manufacturers, both Pfizer and the Moderna manufacturers, are increasing supply. So we hope to see that be, a game changer too moving forward. I was gonna say one more. We are going to continue to offer locations throughout the communities, right? I hope you'll see we try to get into different areas. This week, we're really excited. We're opening a location in Pontiac. And so that offers more choices for people, maybe that, just it's easier to get in their community. Like I said, the drive-throughs, we want to get back to drive-throughs. Drive-throughs work very well for, 65 and over population. They can stay in their car. They drive through an area, they sit for observation for 15 minutes. And so it becomes, it's just easier for them so they don't have to get out of the car. We don't have to worry about ice and it being raining and, somebody falling. And so we are hoping that the temperatures will start to cooperate with us and we can move back out to the drive-through. So now I can take questions.
Commissioner Spiz, I saw you were up first, and then Commissioner Wiper.
Well, thank you. Thank you, Leanne, for that update. Just a quick question, just so everybody that's watching online may have a better understanding. What is our weekly allocation roughly?
So this week we received about 7,000 first doses. The nice piece of the equation is our second doses are automatically shipped to us within 3 to 4 weeks of our first doses being shipped to us. So those second doses are always guaranteed. And again, last week we got a little bit more allocation. We were closer to 11,000, but that was first and second doses. This week we didn't have any second doses, so we were closer to 7,000.
Okay. Now, would you be comfortable speculating on when you think the increase would happen with the Moderna and or Pfizer, based on what you know in the industry?
Honestly, I wish I had that answer. We're hearing it could be weeks or it could be, a couple of months. So, that's kind of what the state has said to us. They had told us that the next 3 weeks, the supply should be stable, meaning we could expect to receive what we had received over the past couple weeks. And so that's kind of how they operate right now, because sometimes they don't have that information. I know they anticipate that Johnson & Johnson really is the game changer by increasing the supply. But at this point, Michigan receives about 60,000 Pfizer doses. And then it fluctuates a little bit for the Moderna, and that's split across the whole state. That's, now pharmacies have become a little more involved, but that's hospitals and local health departments and a few, like you said, kind of like pharmacies. Meyer has received a few doses in some locations to help with some of their special populations.
All right. I guess I will speculate to a point, because I know you probably don't feel comfortable, but based on the research I've done, I see that the Moderna and Pfizer will be able to increase their production to the next level, probably not until the end of March timeframe. So hopefully Johnson & Johnson comes on before that, so we get that phase shift a little bit ahead of that curve. So thank you.
Commissioner Wiper.
Thank you, Mr. Chair. And Leanne, you just covered on a little bit about the state is allocating statewide. And so that goes to hospitals and other places, pharmacies, like you just said.
Mhm.
And people ask me, what should they go get on every list? Is that,
Yeah, I mean, the thing is that, you know, if they're at a hospital, right? Let's just use a hospital system, and the hospitals are really focusing on maybe their clientele that's maybe had some kind of procedure, or they have a physician or a practitioner that's in their hospital system. They may get called faster than what they're going to get called from the health division, right? We have a bigger pot of people, right? Because we have so many different sectors that we're working through the 1A and the 1B. Hospitals might just be focusing on 65 and over. So they're able to get through, you know, their populations a little bit faster, their clients. Same thing with Meyer, you know. Meyer is working off, you know, the list of people that register through them. You know, if you go to Meyer or you're familiar with that, I would get on their list. We are, if you've already received your vaccine and you're on our Save the Spot, we just ask that you notify us. That way we can just keep going, right? We can take you off of our list, and, you know, we'll just continue to ask the next person that's in line. We do that anyway, right? So we invite people, we try to call them. If we don't get anything back, then we move on. We want to make sure that every spot is filled and that we can use at least 90% of our vaccine within 7 days. So we're closer to 95% most weeks. But yeah, that's what our goal is.
thank you.
Commissioner Cavell, and then Commissioner Charles.
Thank you, Chair Miller. Hi, Leanne. First, I've been looking at all the COVID dashboard stuff, and everywhere Oakland County comes up green and everywhere else is red and yellow. So, you know, hats off to you, rock on. To what you were just saying about so 3 quick questions. The Friday correspondence. So everyone who is on Save Your Spot should have gotten some sort of email, phone call, text to confirm. Okay.
I'll make sure I forwarded that to all of you all. Like I said, I'll send it to Barbara and she can push out exactly what it looked like.
Cool, thank you. When will 1C open up? Because I've heard they were thinking May, but now they're thinking September. What do you know, or what do you think?
So I know there's conversations looking at the next phase at all times, but, you know, I think we're going to be, you know, late spring, summer, you know, fall, based on allocation of doses that we would, you know, we have received. You know, it really all depends on the vaccine that, you know, the number of vaccine that we receive. If Johnson & Johnson really makes it different, maybe that timeline, you know, decreases a little bit and we can move to the 1C. I mean, if you look at the number of 65 and over, right, we have close to 217,000 65 and over population in Oakland County. We've only scratched the surface of that. Our even healthcare workers, right? We're still working through, which is the 1A priority. We're still working through that group. We're inviting them to these events, right? A percentage of them. So we're trying to get through them. And also long-term cares. I know some of you all have reached out to me about, you know, senior living facilities and where they fall. We are using our strike teams to go out to these facilities that were not completed by the pharmacy program through the federal government. And we are, you know, trying to provide those vaccinations throughout the week. So that takes a little bit of maneuvering just because they have some work to do on their side as well. So we're working through those as fast as possible.
Okay. That was a good answer too. It could be spring, summer, or fall. You'd be great as a lawyer. When could you also mention something about when people could expect an appointment invitation? And it sounded like you were saying, so Friday you get the numbers, and then Friday to Monday, your team sends out appointment invitations through their first initial outreach preference, right? So phone call, email. And then if they don't respond, you send another phone call, email, robo-text up until what date?
Well, like I said, we're sending additional invitations out today because our Monday event is not full yet. So again, because people are getting vaccinations at other locations,
Sure.
So we're able to invite additional people. And then, Monday, I think we're in Holly. So we'll invite them to come to that event. So, many times we're inviting them to 5 events that we need to fill. But then we get to a point where we still need to fill Monday. And so now we're inviting, these individuals will be specifically for our Monday event.
So, but if I'm talking to voters or trying to share information with people, maybe is it a good idea then to say over the weekend, check your email, or if you get a call around that, like be extra alert on Friday, Saturday to get outreach.
Probably Saturday and Sundays. That's
Saturday and Sunday.
Probably Saturdays is the day we will probably push out that initial email. And then we give people about 48 hours, right? And then we start calling and re-emailing to give them another chance. And then, like I said, we kind of have to move on, right? Because we have to get those spots filled. But my suggestion would be if they can check their email daily, right? Once a day, and they're checking their junk and their promotional, they're not going to miss that email, because we could send them out on a daily basis, trying to get people, right? Enough people in each of those spots.
Okay, gotcha. And then the last thing about provider network, you mentioned the pharmacies. When will that come online? How many places do you think qualify based on the state's rules?
So state of Michigan has about 1,500 providers that are approved through their system, and they approve new ones every day. So we have a list in Oakland County, right, that have already signed up. So that's what we're working through right now. We're reaching out to them to see if they're interested, right? If they're on this list, if they're still interested, can they handle Moderna right now? Moderna and Pfizer, if they can, what's the capacity that they can handle, right? And then we can kind of work through that list so that when we do have, let's say 100,000 doses, right? We can't wait till that's the case. Then we have this network of providers that we're pushing out vaccine to, right? We're accepting it. We're pushing it to them. They know all the rules behind temperatures and holding, and they're doing the work with MICR, which is pushing it to the state. And we're quickly getting out, lots of vaccine to Oakland County residents, because it's kind of like the flu program, right? When you think about flu, you can get it on, every pharmacy has it. A lot of providers have it. If we can ever get to that point, it's easy for, individuals to get the vaccine. And then the health division can really focus on those gaps and those vulnerable populations, to get into the spots where there's transportation issues. And so we can really focus on, that group.
So then in Oakland County, there's roughly how many of those providers out of the 1,500 in the state?
You know what? I'll have to get back to you on that.
Okay, no worries.
I got a list on yesterday, but I did not look at that. So I can forward that back to you. Mm-hmm.
No worries. And then the one last thing is the homebound people and area agency on aging. Is that's moving, or that's going to happen at some point?
I have a meeting today at 4:00 with them.
Oh, cool. Okay, cool. Okay.
Just a little bit, because people probably get this questions. We do have some challenges with the homebound right now, just about moving vaccine once it's been drawn up or a vial has been punctured. So we're working with the state to get clarification. Right now, the manufacturers say you can't carry the doses if they're already drawn up, or that if the vial is pierced. And so we're very cautious about that. We don't want to waste doses. So we're going to be working with the state, but we also know that that's kind of a game changer with Johnson & Johnson as well, that same requirement is not there. So that may be the vaccine that really helps us dive into that homebound population.
Okay, and when will I know you mentioned this? When will the Johnson & Johnson become live?
So their review is at the end of this month, and so they're thinking 1st of March, somewhere first or second week of March.
Okay, thank you for all these questions and being here for us, Leanne.
Hi, Leanne. This is Yolanda Charles, new commissioner. Obviously, I want to thank you for your hard work and all of the people at the county health department who are making things happen. I think it's important to remind the community that you do a lot of stuff, whether it's TB testing, which I've had to do at your facilities before, as well as restaurant establishments, making sure they're staying safe, and a lot more. Moms, healthy moms, is a lot. And so I feel remiss that I'm focused in on COVID-19. But like I said, it's important that the community has a good full gestalt of what you are working on. So I do pride myself on advocating for the whole household, the whole family. I know we are focused a lot on our 65 and ups, but I did hear from some superintendents over the weekend who provided me with some very concerning some background. And so I wanted to check with you. First question is OCHD coordinating at all with Oakland schools in terms of the rollout of the vaccine? I know that based on the superintendents that I spoke with, they all acknowledge that a lack of statewide coordinated effort to ensure K-12 educators receive the COVID vaccine was missed. That's widely accepted and acknowledged. In lieu of that effort, though, it seems like each county is tasked with basically rolling out their own and developing their own system, which again is very local. I'm all for local control, but it also breeds competition. And it sounds like from the beginning, doses of the vaccine have been received in the county were a few less than some of our contiguous counties. Sounds like Ascension Hospital has decided to take their allotments to Macomb County, which, you know, hashtag Team Oakland. I would prefer that would not happen. I'd love to hear if we're working with that and how that could be rectified. I also am just articulating this not because I think you have the full control, but that it's articulated at least for the community that, you know, we're talking about putting teachers back in school in 3 weeks. And I can tell you in Southfield Public Schools and my surrounding schools that our teachers aren't getting the vaccine per capita as I think they should. The last communication said that about 50,000 vaccines or something about 50,000 educators in Oakland County. I'd be interested in seeing what the breakdown of the data is on the southern portion of the county, how those teachers were impacted, because let's just face it, we have more population. People are closer to each other. And I wanted to know how that was prioritized, seeing as how I'm getting feedback that we're not being prioritized. Ecorse, Battle Creek, Muskegon Heights, Lansing would all be examples of school districts that have coordinated with their counties in a very meaningful way. And so those are vaccine questions. And again, I'd love for you to respond, but if you can't, I understand that you might need some time. But my last question is about data security. Just recently in the Michigan Association of Counties digest of emails, they talked about just the vulnerabilities of health departments across the nation, and that we're not prepared for the next one, if you will. So we're doing okay now, but we're not preparing for the next one. And so I'm just laying it at your feet in terms of future thoughts. You know, how are we protecting people's data to avoid any Russian or Chinese hacking and what have you, and checking for vulnerabilities there. So the first question was just about how are we working with Oakland schools, if at all, and then in terms of data security.
So Oakland schools, we have been working with Oakland schools really from the beginning of this. So we have a weekly meeting with superintendents where we go through, you know, data and priorities. And I can tell you, some of our largest sites, we have invited, you know, we have one site where close to 90% of the invites were teachers. And so we have prioritized teachers from the very beginning, knowing that we want to get our kids back to school and get our teachers vaccinated. So we have made it a point to make sure our educators are the priority or a priority. Again, we have a significant number of healthcare that also were not actually offered the vaccine through the medical providers. So, you know, those two have kind of been mirrored as the priority at some of our, especially some of our first larger sites. And so specifically to the South End data, I'd have to look and maybe I can get back to you on that. There's a little bit of disconnect. We can probably tell you how many have been invited to receive their vaccine. But the systems are not connected based on sector. So once they receive their vaccine, that's a state system. And so it's stored differently. So I wouldn't be able to tell you unless there was a survey done, which you know, in the community at each school district, how many had been vaccinated, because I do know that some hospital systems have also been trying to focus on teachers if they're aware they have those clients. So we hear the school districts. We continue to work with them on a weekly basis, and we will continue to prioritize them and invite them to our sites. For data security, I have to say we have one of the most robust IT departments, I would say, in definitely the state, in the country. If Mike Tim is on here, I would let him, speak up to this and say what an amazing department we have there. I think they're always trying to think ahead for data security. And so I think that would be a great question to maybe bring him in and let him talk about that, because I know they do everything they do tests and things to make sure we're protected. And so that would be a great opportunity for him to kind of talk about the things that they implemented and made a stronger infrastructure for Oakland County.
Any other discussion or questions? So can you guys hear me? Okay, it says at the bottom I'm muted, so it's weird. But no, I was going to say the same thing about the IT, so I appreciate that. I had a couple questions with the upcoming Johnson & Johnson shot going to be released, right? Is there going to be do people have the option of which one to get, or is it just wherever it is in line? Because I'm sure this is going to be a question, right? Because we know that, I've heard, and I'm not a scientist or chemistry or anything like that, even though it's my favorite stuff, but that the Johnson & Johnson shot is not as effective as the other ones. So is our individuals, when they get that call, they say, well, I want that shot or I want this shot?
When it gets to that, we have whatever doses we have in front of us, it will be, our recommendation is when you're offered the vaccine, no matter what it is, take it. Now, I know Johnson & Johnson is looking at possibly a second dose to increase the effectiveness of, so they're doing some studies to see how that increases the effectiveness. So it's being looked at, but, right now we have both Pfizer and Moderna, but we set a site for either Moderna or Pfizer. It just takes down possible errors, right? And so it's really important, especially when we start talking about second doses. We really are trying to focus on whatever the manufacturers that we give. If we give Moderna first, in 28 days, we're going to give Moderna again. And so I think as we continue to build that, we want to continue to use that same method. And so this has been actually a topic of discussion that health officers have been talking about in the past week or so as Johnson & Johnson continues to get talked about. And I think the best answer right now is when you're offered the vaccine, whichever it is at this point, right, take it. And again, if it's the first one of Johnson & Johnson, then maybe a second one comes on board later on that increases that efficiency. And so it's probably going to, be if unless someone's allergic to something or has some kind of sensitivity to it, then, those discussions could occur. But it will probably be, what's at the site that you've registered for. And, sometimes Johnson & Johnson may outweigh what we get from Pfizer and Moderna. So we may receive more from that. And that might be the priority that we're giving, or the majority of what we're giving.
So with that, and you brought up the point that I was going to bring up is, so if they have some kind of allergic reaction, anaphylactic, what have you, are we going to add that to the Save Your Spot to say, so we know like they can only get the Johnson & Johnson one? People generally follow up with us, I can tell you, but that's a great point, something we need to think about. If someone can't if a doctor or a physician has said, don't have this versus this, people generally call us to say, okay, I've registered for this. What are you providing at that? And so there is some flexibility, a little bit of flexibility we can provide for those situations. But if there has been some kind of, reaction to a vaccine, local health department, we can't give that vaccine at our locations, right? Because we don't have the tools, right, to be able to. We do have EMS on site, but so if someone has had a prior reaction, we're asking that they wait for their hospital system or their provider or practitioner to be able to receive that vaccine so that they can be monitored more closely in an environment that is trained for those things, where our nurses are not really trained for emergency room, use of, medications. We just have them available if they're needed. So. Yeah, I appreciate that. I just think it'd be good if they add that box for housekeeping for you guys logistically, and so you know, right? So it's actually, I think it would save you guys some time for those follow-up calls. And the last one, the other question I have is there any potential of having an estimate call? I know we've talked about, you get on the list, you could be number 30,059, but you might be next week or you might be in 2 weeks. Because I know everybody's getting calls, and it's just like, if we're getting 7,000, is there maybe a robocall, like potentially next week or in 2 weeks, your number will be in line? I know it's kind of you probably get this all the time, but just a question, right?
Yeah. This is probably one of the most challenging, issues that we've tried to address. And that's why we try to keep people engaged in the conversation, and, newsletters and videos on a weekly basis. And the hardest part is just trying to say, be patient, it's coming. It's even hard for me when you get the calls from, people that say, my husband is very sick. When can he get the vaccine? I don't know how we would do that, but what I will do is I will see if there's something that is available that would allow us to do that. Because again, without us knowing what the allocation is each week, it's hard for me to say, if I was to call, Commissioner Miller, or give you a call and say, next week, you're going to get the vaccine, or the invitation to get the vaccine. And then I only get 1,000 doses, right? Instead of 5,000 doses. Then you have people at this expectation, and then why didn't I, there's a lot to think about there, but that's definitely something we can see if the technology exists, and then something we can think about.
Yeah, and I was thinking it's kind of like a call where it's an estimate, so you're not giving them a guarantee, just to estimate it. If the doses consistently come as they've been coming regularly, this is what's estimated, so you're not giving a guarantee this is when you're going to get it. So you kind of eliminate that. Might not be next week, but we're estimating just to, I'm sure you're getting the calls, all the commissioners getting the calls. It's just the comfort for our constituents to know at least that they're on the list. I know they get the confirmation now, but they're still nervous. Well, I got the confirmation. I've signed up 3 times. I finally got a confirmation, all this stuff. So that was just a question just for housekeeping wise again, so. But Commissioner Markham.
Thank you, Mr. Chair. I just have a question as it relates to if you have tested positive for COVID, but you're scheduled for a shot, what should people do? And does it matter if it was a week ago, a month ago, et cetera?
So what they say is 2 weeks after active infection. So what I would do is, we have had people that are in quarantine and their appointment comes up. And so what we would say is, if that's your case, do not show up at the site. If you are quarantined and you have an appointment, call our nurse on call. We're not going to skip you over. We will get you a new appointment. We want to make sure people, exercise that quarantine period. That's very important for us to control the spread of the COVID, but we want to make sure too, when it's their turn, they're allowed to get the vaccine. So what we do is we either try to schedule them out, or we'll keep a list and call them back to schedule an appointment when we know their 14 days they're past their 14 days.
Perfect. Thank you.
You're welcome. Thank you.
We're no other discussion? Sorry, I was on mute. No, we don't hear any. So thank you for letting us know and informing us. And I envy you in your job, because I'm sure you probably need 7 phones, because you can't even handle the phone you got right now, right? So we appreciate you and the job you're doing.
Thank you.
Thank you. So now we have the next agenda item is Facilities Management, Health and Human Services approval, acceptance of Amendment 1 to sublease agreement with Easter Seals, Michigan Incorporated in Oakland County. Need a motion?
I'll move it.
Moved by Commissioner Wiper, seconded by Commissioner Charles. And we have
Hi, how are you?
Great Leanne back again.
I think Paul is going to take this. Is that correct, Paul?
Hey, I'm on the line. Can you hear me?
Yes.
All right. Yep.
So I'll just go over this. Pretty much, this is a renewal of a lease. It's actually a sublease, as in the county. A little bit of history. The county used to own that building. They sold it several years ago. The landlord leased to Easter Seals, And then now WIC, or the health department, their WIC program subleases, the county subleases from Easter Seals. So Easter Seals has about 7,000 square feet. And for this WIC program, the county has about 380 square feet. So we're basically just moving the sublease continuous. Supposed to be 1 year, but because of COVID and everything, we just got to it. So we'll probably have to be renewing this again later in the year. So the program works well out there. I know that Lisa and Leanne are saying they're not using it much because of COVID, but it's a nice location because everyone's familiar with it. It used to be a county building. And you drive up the parking lot, it's one level. You walk in, there's a little reception area that they use in East, and then the county WIC program is using Easter Seals, their technology and their Wi-Fi and their copiers and their phone system, all that. So it works well, and I assume after this expires, that the WIC program will continue there. So we're looking just for a renewal, approval to renew this lease. It's sublease.
And I was going to add one thing. We have been virtual for COVID, but the state allows the WIC program to be virtual. And then at a certain time, and I think they're shooting for the end of May right now, that we would be back in person. So we'll be back in that building. Where we can, work with them on mitigation if we need more plexiglass or whatever it is, when we move forward to when we're back in person. So,
Thank you. Any discussion? Seeing none, call the roll, please.
Charles?
Yes.
Wipert?
Yes.
Markham?
Yes.
Cavell?
Yes.
Biz?
Yes.
Miller?
Yes.
We have 6 yeas, 0 nays.
Motion carries. Thank you.
Thank you.
Next agenda item we have is facility management, facilities planning and engineering, circuit and probate courts, COVID configuration of courtroom projects. Moved by Commissioner Spiz, seconded by Commissioner Wiper. And I see we have, are you taking this over, Art? I see you're on here. I don't see Ed on here.
I'm on here. Ed Joss is on here. We're going to
Oh, there
handle
he is.
any
There, yep.
questions. John Cooprider, Ed Hutton, and Judge Ryan are also on the line. They, of course, explain why this is so important. Ed, you want to give a quick overview of what we're doing?
I can kick this. I think Ed has his self muted there. I can kick this thing off. We're seeking funding to purchase and install protective screens and plexiglass in selected courtrooms, specifically chosen to hold jury trials. There are 6 circuit and 1 probate courtroom. We've been working closely with our friends at facilities in order to adequately outfit the courtrooms, all while maintaining the social distancing requirements. The cost is just over $68,000, and we're seeking your support.
All right.
We're here to answer any other questions that you may have as well. I know our court administrator, Kevin Offner, is on here. So is Ed Hutton, the probate court administrator. Oh, I see Judge Ryan is here too. Judge, I don't know if you have something you want to say about it.
No, just good morning, everyone. I'm just sitting in. Ed Joss and Ed Hutton and yourself are far more familiar with all of this, but I'm just here to answer any questions. But hello, everyone.
Hello, welcome. It's good to see you.
So this is Ed Joss. So
Yep.
hopefully you can hear me now. John, thank you for that. And as John, John did a good job of explaining what it is we're going to do with the plexiglass barriers and the decals. So if you have any questions related to, the actual construction or the material we're supplying and or the cost of it, I'd be happy to answer any of those questions.
I see Commissioner Spiz has a question.
Yeah, I do have a question. My question is not related to the material or the construction or exactly what they're doing, because I support it all, because I think it needs to be done to get the courtrooms back up and running. My question is more where the funding is coming from. It looks like it's coming from capital improvement programs. So my major question is, and I'm not sure anybody here can answer it, is why aren't we not using the CARES Act funding for this?
The original CARES Act expired on December 31st. So all of the funding requests to use that funding had to be in before then.
But I believe that's been extended. Plus we have a additional funding we didn't use from the 219 million that we set aside that the administration is working with right now. So to me, this still falls under that. I'd like confirmation through Hillary and administration and
it definitely
Sean
would
that we can't do it.
qualify. It would definitely qualify for that funding. We can confirm with fiscal. But what I was going to say is that if and when additional CARES-like funding is available, the capital improvement plan would then be reimbursed for this money out of that CARES funding.
Right, Commissioner, I'm looking to see if anyone from Fiscal Services is on, but as Art said, we did work with Fiscal Services on how this would be funded from facilities management standpoint, as well as the courts. I think we all preferred that we could use the CARES Act funding, but Fiscal Services explained why we could not in this instance, and then that's why we had to resort to using the miscellaneous line item in the capital improvement program.
Okay, I guess I can understand. I just like reconfirmation that that is still the case, because I'm under the impression that that timeline has been extended with the late extension by Congress last year.
I'll talk to Sean and Lynn about that, and Kyle, Jen.
All right, thank you.
Now we have Commissioner Wiper.
Just to follow up on the comment. So the CARES Act didn't expire December 31st. Our 219 million allocation was distributed by December 30th because we thought it was going to expire. So then Congress extended the timeline, but Oakland County did such a good job on distributing the $219 million, saving the small businesses and everything else. So that's where our money went out by December 30th. And there was a small portion, I think of about 5 to 7 million, that got allocated into overtime so that it wasn't wasted just in case the CARES Act did expire. But since it got extended, there is some money sitting, and it might be allocated for courtrooms and PPE and things like that. But I imagine it might go to small businesses first. So that's still out there.
Commissioner Cavell.
Thank you, Chair. I just wanted to say, Commissioner Spiz and Wiper, good eye, good catch. I did not notice that. Thanks for that.
Commissioner
It comes
Charles.
with time, Charlie.
Thank you. I guess I echo Charlie or Commissioner Cavell. I want to just make sure I'm clear, Chairperson Miller, that when we have staff revisit something because we believe perhaps another fund could help, does that then I shouldn't say table, but does that then push this off until another meeting, or do we still vote?
No, we still vote on it. This will just, it would just reimburse the funding if they've already spent it out. Then, I mean, we'll talk to the seasoned Commissioner Spiz with time.
My question is does this have to go through finance? Because what we could do is one can go to finance and then we can amend it then, and or we can amend it on the floor.
It does not have to go to finance.
Okay, so we can amend it on the floor at the Board of Commissioners with clarification and probably add a note.
if Art gets the information back, we can get it distributed to this committee as well as any
Yes.
other commissioners that you would see appropriate.
And or add a comment about any additional CARES Act funding that come in, we could adjust it then too.
Correct.
Commissioner Charles for the second time.
Technically still my first time, but I'm kidding.
Oh.
I just want to clarify. So in our processes at the county, we, for example, have a building improvement fund, and then we will transfer things out of that fund into a particular work order fund. Is that how I should understand it? I'm coming from a space where we're always talking general fund and we try to avoid hitting the general fund. If you could just explain that briefly.
Yes, that is how it works. So there is a building improvement fund. Every year we do a capital improvement plan, which uses the monies in the out of that building fund. And also every year that building fund is provided additional money out of the general fund. But only that building fund can be used for capital related purchases, assets that have a 10-year life or longer. Once the resolution gets passed, just like you said, Commissioner, the money then goes into a project work order fund. So then it can't be used for anything else other than what that resolution was dedicating that money for.
Thank you.
Any other discussion? I don't see any. The one question I have is this our in-house maintenance that's going to install this?
Ed, are you still?
No, I am, yes. No, it is not. So we've competitively bid these barriers for all of our needs. And so they are manufactured local, but we are paying the company to deliver and assemble all of the barriers.
Okay. What's the name of the company?
So we're using two companies for this project. The one is Phoenix Cabinets and Tops. They are the manufacturer of the barriers. We're also using Area, which is a furniture supplier that we use, and they help with some of the labor portion of it. And they provide their expertise on the furniture side of it so that these can be attached properly and safely.
Thank you. Any other discussion? Seeing none, call the roll, please.
Whitebird,
Yes.
Markham,
Yes.
Lavelle,
Yes.
Biz,
Yes.
Charles,
Yes.
Miller.
Yes.
We have 6 yeas, 0 nays.
Motion passes. Thank you.
Thank you.
Next agenda item, we have facility management, facility maintenance, and operation prosecutor's office, various prosecutor office upgrade projects. Moved by Commissioner Charles, seconded by Commissioner Markham.
All right. We have Betsy Haig from the prosecutor's office on the call here with us. She can give a more detailed explanation of why this is so important. But in general, the prosecutor's office floors in the West Wing extension have been, unfortunately, somewhat neglected over the last 10 or 12 years, without getting into the reasons why. But new prosecutors coming in the fall, they started identifying the things that needed to be done. They got us involved. We helped determine what the cost would be. And then with county executive support, we set aside a certain amount of money, which is outlined in the resolution there. And that's why we're here today.
All right.
Yes, my name is Betsy Haig. I'm the Chief administration now for the prosecutor's office. And I want to thank Art and his team tremendously for their assistance and helping us as we've kind of come in and begin to make ourselves at home here. We did find that there, as he indicated, were many issues with our building, things that haven't been updated. Sometimes I would say agree with in the last 12 years, but also things that I don't think they're original to the building, which my understanding was built in approximately 26 years ago. So we have all kinds of like yellowing and peeling wallpaper, carpet that's completely worn, various issues with our facilities. As indicated in the MR, we've had several meetings where we've identified areas that need improvement, and they've been very gracious with their time and helping us to figure out solutions to that. So we would ask that you do allocate us the money so that we can make these improvements to our working environment.
All right. We have Commissioner Spiz, but before Commissioner Spiz comes on, did we get the information, Art, that was requested?
Yes, we had emailed a few books to Commissioner Spiz earlier this morning. If you'd like, I can go through that real quick.
Well, I'll see. Well, we'll let Commissioner Spiz and see if that satisfies his need for that first.
Okay.
Well, they did answer all my questions and they gave me the information I was looking for. So thank you, Art and Ed and Charles. So I appreciate that. My question is probably more to Betsy. Looking at the list and looking at some of the things on here, some of them look more like wants versus needs, in my opinion. But you're closer to it than I am, so I'm kind of asking, because if you look at the resolution, it has wall art, it has brand new break rooms, things being added into the area. I can understand with the new prosecutor coming in, setting some things up, making some changes, move some things around. But this almost looks like a complete overhaul of that area. And $250,000 is a lot of money, And of course, I could see new signs. Of course, you need that and some of the other things. But do you really need to spend $250,000 is really my nutshell question. Can we cut that in any way?
Sure. So I think identifying some of the things as wants, not needs, we're trying to make ourselves a 21st century prosecutor's office. We don't have a space to host any people from the public, the media. You might notice that yesterday we had a press conference in a room that was basically bare bones because we had to strip of all the outdated materials that had been left inside. We have no major space to do a training for all of our employees within our facilities. The one room that is large enough was completely ill-equipped for that and had furniture that was not just dated, but also falling apart, broken and stained. With regard to wall art, I guess I would say, again, this is a working environment. Just did a huge salary study to try and keep and recruit professional people, and especially within a prosecutor's office where you have attorneys, to have bare walls that currently are peeling and yellowing wallpaper. The morale here with regard to the facilities is quite low. And I will say the improvements that we have already undertaken, updating our water stations, things, people weren't allowed, my understanding, into this office to do any kind of repair or improvements. And people are just very excited to be a part of even just these minor little changes, like the water bottle stations to fill up your water bottle, they didn't have. So the ones
we actually have some of those in the warehouse, I believe.
Yeah, no, exactly. Like these are things that we didn't even know were available to us at the county already owns that just have never been installed here. So I don't think anything on this is frivolous or unnecessary. And in fact, We have a prosecutor who has a criminal justice reform initiative that she is bringing our county to the forefront on, and we need these things to be able to do our job.
And I can appreciate your comments, and I can appreciate the technology side of things, because I don't think it's any surprise that I was hoping that IT would report into this committee. But and I think you're aware that we're making some major upgrades to the Board of Commissioners auditorium for technology purpose, and the administration did. So from a technology standpoint, I don't have an issue with what you're requesting. To pick on one thing in particular, I think you're looking to add 6 or redo 6 new areas that are for, let me pull up the list, hold on.
I think
Kitchenette.
you
6 new kitchenettes for $90,000.
So we have these areas already within our office. They include countertops that are coming apart, that are currently like taped together because they're so old. They're yellowed, stained, not functional or barely functional. So these are areas that are already in place. We're not knocking down any walls or creating these spaces. They're actually in place. We're just trying to update them and make them, I guess, what would the word be? Not just nicer, but a place where you would be willing to store your lunch.
Okay, thank you.
Commissioner Charles, and then Commissioner Wiper, and then Commissioner Markham.
Yes, thank you, Chair. I wanted to speak in favor of this particular initiative. I am looking at the bullet points. I fully subscribe to bringing what should be a 21st century prosecutorial space, let it match 2021 to some degree. It looks like there's been 25 years worth of deferred maintenance, deferred upgrades, and really all it does is make the price go up over time even more. So I appreciate it and can fully receive why the purpose of it is on the agenda today. Thank you.
Commissioner Wiper.
Yeah, when I saw the package, I thought the same thing as Commissioner Spiz. That it was seemed like a little bit of borderline wants versus needs. But after hearing from Betsy and from Art, and knowing the history that we're making a transition to a new prosecutor, and there was an established prosecutor there for a long time, which was always fiscal conservative, and not much was done over there. I can see it is more of a need. And I'm sure countertops with COVID need to be clean, fresh countertops, and we need to have a world-class space for a new prosecutor's office. So I don't have any problem with any of this. Oh, there was one thing I know we did at the end of last year. We did allocate money for a transition from knowing the new prosecutor's office, and if there's any funds available left from that, or I don't know if they've been expended, but that could be used for, to me, that's wall signs and things like that. So hopefully there's something there that's been explored.
And I can speak to that. So we did have the transition fund. Some of that was allocated towards employees assisting in getting us on board. But I believe the balance of that has been allocated towards updating the prosecutor's personal office. She did it. That was in quite disrepair, and so there have been that money has been allocated to that, and I believe has been spent on it.
If I may too, I just wanted to make a comment on what Commissioner Weipert said. Commissioner Weipert, you had mentioned that we're transitioning from a prosecutor that may have been very fiscally responsible or lean, but I think in this case it's much more than that, right? I think Betsy or Art mentioned it, but the prior prosecutor wanted to maintain the highest level of security of that space. So as it was mentioned, I don't think there was much public brought in, and the facilities management staff wasn't even really allowed to access that space. So it wasn't just a matter of the prior prosecutor trying to save money and be responsible with the money, but this has been deferred for a very long time simply because that space was almost completely locked down to everyone except for those that worked in that space.
All right. Now, thank you. Now we have Commissioner Markham, and after that, Commissioner Cabal.
Excuse me. Thank you, Mr. Chair. Mr. Joss, I find that very interesting, that comment you just made about how the philosophy from 15, 20 years ago really impeded our ability to keep up with what the office needed. I find that very interesting. My question is, if we do this, is this everything that you need, or will you be coming back to us, you know, a year or two from now with $100,000 more? I would rather see us do it right, do it now, one time is my point. Because I think it is more efficient and things do tie together better. So I can see the necessity for it, but I want to make sure it is complete with everything that we think we need. So I don't know who answers that question, but that's my point.
Then Commissioner Cabal.
We did walk through every floor with Betsy, David, and Karen. We looked in pretty much every common space, conference room, hallways, the press room. So I'm reasonably confident that we do have everything included in there. But of course, I don't work in that space day in and day out. So, I mean, I'm sure Betsy would be weighing in right now if she felt strongly that there was going to be more remodeling necessary.
Thank you. Commissioner Cabal.
I think Betsy unmuted herself to say something.
Oh, I didn't see that.
But I'm happy to go after.
Yeah, I think Art is exactly correct that he's been very generous and his people have been very generous with their time. And so our hope is that this is our big project.
Commissioner Cabal, then Commissioner Wiper for the second time.
Thanks. And Betsy, I just want to say, excited to see the changes happening in the prosecutor's office and happy to be supportive of this now. But I just want to make sure, not so much for you, but for everyone else to know that, right, we ran on a platform of being very vocal about economic and moral reform to criminal justice. So this is kind of akin to when I was in college and my cross-country coach bought me shoes and he said, you get these shoes from Wayne State because we expect you to deliver. So I'm happy to vote for this, but I want to see an end to cash bail. I want to work on this sort of thing. I want to see problem-solving courts. We're giving you the tools to succeed here. So I just want to let you know that that's the expectation with my yes vote.
Thank you. Now, Commissioner Wiper.
Just follow up, put perspective why I don't have any problem with this. If you and not to say the former prosecutor and the new prosecutor won't both be fiscally conservative and responsible, but if you look at the timing, the building is about 26 years old, and then as probably one key time of getting things done is when we hit the crash of 07, 08, 09, and then everybody had to put the reins on everything. So here we are now with a transition to a new prosecutor, and it's 26 years old, and nothing's been done. You know, because you hit the hard times in 2008, which everybody pulled together. So I don't have any problem with this. It's time. So let's get it done.
Commissioner Spiz for the second time.
Yeah, just one final comment on from my standpoint. At this point, I'm not willing to support this dollar amount, but I would like to do is take the opportunity to take a walk through the area myself so I can see it. Because I did get some pictures, I did see some things, and I can understand having a workplace that is inviting for top-notch professionals to come work in, public, etc. So before I'm going to vote no on it today, but you could potentially flip my vote to a yes on the floor after I take a walkthrough. Thank you.
Thank you. Commissioner Charles for the second time.
Yes, sir. I apologize for having to have a second time, but I do concur with Commissioner Spiz. I meant to mention in my first set of comments just simply that pictures go a long way. Having some photos embedded in the report could, save me the desire to join Spiz for this tour, but I would like to see it as well, just because I would like to see it. But thank you.
Yeah, you're more than welcome to anyone who wants to. We can arrange a tour. We can put my email in the chat.
Gotcha.
All right. We do appreciate that. I will say that I know Commissioner Charles and Commissioner Cavall did not have the opportunity as we did 2 years ago to tour the courts rooms and what have you. So I mean, I'm in support of this. I've been in there. I've seen, like there is some upgrades. A lot of people would say that our courtrooms would remind them of the old show Mad Men, right? That type of year, right? So I agree to this, but I would like a tour after it's done to see the new improvements. So if there's not any other discussion, we'll call the roll.
Markham,
Yes.
Cavell.
Was that Cavell?
Yes.
Yes.
Yes, Cavell. Spiz,
No.
Charles,
Yes.
Whitebird,
Yes.
Miller.
Yes.
We have 5 yeas and 1 nay.
Thank you. Motion passes, and thank you, Betsy and Art for and Ed for your explanations.
Thank you very much for your time.
And then we have the next agenda item is Water Resource Commissioner resolution to authorize Oakland County Farmington Hills Water Supply System Refunding Bond Series 2021. Need a motion? Moved by Commissioner Wiper, second by Commissioner Spiz. And we have Sid here. How you doing, Sid?
Good. Morning, Chairperson Miller and Commissioners.
Morning.
Yeah, we have an easy one today. No COVID, no big money getting spent. Looking to save some money for the city of Farmington Hills. And then the next agenda item was for Pontiac. But in this one, these were the bonds originally sold for the big water tower you see on 696 drive toward Farmington Hills. There's a big sign up there and the related water main that went to that. On the chat with us here on the video meeting, we have Eric McLaughlin from Dickinson Wright and Steve Burke from MFCI, who are the people who put this together. MFCI is always looking at our bond issues when they come up to be recalled and the current interest rate and do analysis, and they let us know when these are any questions anybody has.
Any discussion? I don't see any. I appreciate it. That's my district is Farmington Hills part of it. So I appreciate that. Real quick, I would ask, because I don't know if everybody knows what those water towers actually are for and what they do. So if you just get a quick, understanding of that.
Sure. Yeah, mostly they're for storage. So, in any like water sewer system, we have what they call a diurnal curve. And that mainly is the function of people. It's shifted now because of COVID, that people go into work and coming home. So you have like 2 Camelback, humps during the day. And so those peaks, put a strain on the system. So in order to shade those peaks off, you build water storage. So you're not on demand and you have low pressure and things like that. Also for fire flow. But in this particular one, I wasn't involved in this project, but I know enough about it in our office. This one was how it was built because of how Detroit and Gleewood charges the peak rate for water. So this one shaved off the peak charges for that, and I think it was for around $7 million, and it's going to have like a 7-year payback, I think, based on the peak savings. That one was built for peak and to help fire flows as well. But yeah, that was a winner for sure to build something had that shorter payback period.
Definitely. So if there's no other discussion, we'll call the roll.
Cavell,
Yes.
Spiz,
Yes.
Charles,
Yes.
Whitebird,
Yes.
Markham,
Yes.
Miller.
Yes.
6 yeas, 0 nays.
Motion passes. Thank you. Now we have our next agenda item, which is the Water Resource Commissioner City of Pontiac Water Waste Treatment Facility Drainage District Drain Refunding Bond Series 2021 Taxable Full Faith and Accredited Resolution. Need a motion. Moved by Commissioner Charles, seconded by Commissioner Markham. And we have Sid again and Sid.
Yep.
All right.
Yep. Same team to answer questions. This one, since the bonds were bigger, looking to save some more money, approximately 4.9 million. Obviously, for both of these, this, the prior one, this one, we'll know what those savings are once we sell the bonds in the future. When we get all the paperwork in order. And historically, this one was the one a bunch of puzzle pieces between 3 financial managers of the city of Pontiac when they had those, and this is the 3rd financial manager that helped put this deal together with Oakland County Water Resources. They, I believe, gave Pontiac in the $55 million range to help them get out of trouble with the state of Michigan, and then had some funds going forward. I believe that's why these are taxable, not non-taxable, because the funds just weren't for capital improvements. They went, once Pontiac got it, it went other places. And this one let us take ownership of the wastewater treatment plant and related water and sewer system in Pontiac that then became a Chapter 20 drain that we now are doing major improvements on. And also we shifted flow from the Clinton Oakland system, built the Perry Street pump station in Force Main. That plant was half its capacity at that time. And we built the Perry Street pump station in Force Main that diverted flow from the Clinton Oakland system that's helping Pontiac repay back these bonds. So it's savings, even though you see in the paperwork here that it's $4.8 million, the city of Pontiac contractually, it's shared with the Clinton Oakland as well through contracts after this.
All right. Any discussion? Commissioner Wiper.
Thank you. And it's more of a general question. Maybe you can educate the committee. Our bond folks on, is that
yes?
Eric, how you doing? So if you go just in general, when you go down into the package, look at net present value benefit 8.4, and then net present benefit refunding principal 9.8. Is there? And then it tells you. And on the two, one saving $5 million and one saving $900,000. So where are we with the bond? How do you make that decision when it's a good point to do this?
I'll let Steve Burke answer that from MSCI.
Hi, Commissioner. Good morning. So the county's policy typically has been a savings of at least $100,000 or 2%. Whatever is higher, has been the county's approach to these over the last 20 years or so, I believe.
And so are we regularly reviewing what, we look at it every quarter, every 6 months, as the markets change, and you go through the different outstanding debts and say, when's this a good time to do this?
Sure, correct. So each of these bonds are callable on a set date. I think for Oakland County, we know when all of the bonds are callable and on what schedule. Given the continued ultra low interest rates, pretty much as all bonds become callable for the county that have been sold, they are eligible to refund and have savings. If the interest rate market dynamics change, that could change. But for now, pretty much as all of these come up to be callable, with any sort of length of time left to the final maturity, we are able to refund them and refinance them for savings.
Thank you.
All right. Any other discussion? Hearing none, call the roll, please.
Biz,
Yes.
Charles?
Did you say Charles?
Yes, Charles?
Yes, thank you.
Wipert?
Yes.
Markham?
Yes.
Cabell?
Yes.
Miller?
Yes.
We have 6 yeas, 0 nays.
Motion carries. Thank you, guys.
Thank you. Appreciate it.
Then we have the last agenda item, which is facilities management concurrence for public sale and minimum sale price of 1700 Brown Road. Need a motion? Moved by Commissioner Charles, seconded by Commissioner Markham.
Morning, Commissioners. Paul Zackles, Property Manager. With facilities, this is a request by the Commissioners, by the committee to concur for a public sale of the property. If you've read the background on the property, the city has owned it for a long time, or the county's owned it for a long time. And we've put the sale in action a couple years ago as we went through the process of trying to sell it ourselves and then listing it with a broker. The market did not cooperate. Of course, there was COVID, and then probably another problem was the China trade war made the economy unsettling and the industrial market in that area not as robust as it could be. Well, since then, the election is over. The property was lowered in price. It started at a high price. The first listing was at 4.65 million, and it's been lowered to 3.9 million. So currently, the asking price on the listing with Colliers is 3.9 million. We're asking for concurrence to do a public sale, which would allow the bidders and anyone else interested to all submit at the same time sealed bids to the purchasing department. And we've set a minimum bid price of $3,250,000. So I was talking to the broker just yesterday, and he feels the property will sell more than that. I don't really want to give the specifics of those since this is public. I don't want to give the specifics of those offers, but we have offers in the prior, in the range of that number to the asking price. So we feel it might even go over the asking price if these developers have a high demand. So what we're seeing is the demand all of a sudden jumped. Several developers interested at the same time, and that's going to help with selling this property. I'm open to any questions.
Commissioner Spiz has one or two.
Might be more than that. I'll start with one. Does anybody here, and Art or Paul, you may remember, what was the number we used in the business case for the new animal shelter for the sale of this property? Because I know we used the sale of this property as somewhat of the business case. I can't remember that number.
I believe it was 3.5 million to 4 million, if I'm not mistaken. It could have been as high as 4.5 million, but it's been a few years since that was.
Yeah, I know. Okay. Okay.
But it's in the range.
And you guys feel comfortable with this 3.2 based on Paul, your comments? I know you don't want to share too much because this is a public meeting. And
we're asking that the concurrence of the, the minimum bid be $3,250,000 set by this committee for the public sale option.
Yeah, we've had interest at that level and above in the recent month or two, so we're quite comfortable with that range.
And the only thing by setting this number would be is any of the sealed bids we get below that would just be thrown out, right?
That's my understanding, correct.
And the property is the largest undeveloped piece of Auburn Hills industrial in all of the city. I'm in contact with the city planner, Steve Cohen, quite a bit, just to see, what he knows in action, with the city development, that kind of thing. So we talk every couple months, and he says to me the same thing. Paul, this is the last piece of property that is, it's 30 acres of developable. It's 40 acres total. So that the property only gets, more.
Okay. Unfortunately, gentlemen and ladies and gentlemen, I got to run to a meeting with the executive board here at my day job, so I got to cut off. But I personally like to see the number a little bit higher, but if the rest of the group concurs, I mean, we can go with the number being 3.2 since it is a sealed bid and we get Cross
Yeah,
the
we're
fingers, hope we get a higher number.
Yeah, we're confident we'll get a higher number. The broker has estimated it'll be closer to the 4 million price.
All right, thank you.
Thank you. Commissioner Charles and then Commissioner Cavall.
Thank you. Have a good day, Spiz. I just wanted to go on record so you guys know where I'm coming from. When you sell land, it does look like it's a brownfield, so I'm happy about that and not a green space. It is in Auburn Hills. I don't know how charter schools proliferate in the Auburn Hills area, but I would be remiss if I didn't say that I am not a fan of property going to charters. If they have $3.2 or more million to build a school, then I guess God bless them. However, just as a principle, I always like to make sure I articulate that. And again, my other question you already answered, which was whether it was considered a brownfield and some of the technical spaces there. But as long as Auburn Hills is okay with it, I see no reason not to approve.
Well, the property is in a light industrial area, so more than likely this will be a light industrial building, distribution building or corporate headquarters and that type of thing. It really doesn't lend itself to being a school or that type of use because the entire area is industrial. General Motors' large plant is across the street.
Yeah, it would have to be rezoned to accommodate something like that. And for the record, I'm not real crazy about charter schools either. So
After Commissioner Cavall, we have Commissioner Wiper.
Can you hear me?
Yes.
Oh, okay. No, I didn't have a question. I was just waving bye to Spiz.
Oh, okay. All right, Commissioner Wiper.
I mean, the whole point of this is getting this thing out of the tax rolls and getting some economic development. So that could be part of the bid process, right? We could condition it that it's going to be put into industrial service or light industrial.
yes, that's why Auburn Hills has been so supportive of this.
Makes sense. Any other discussion? I will say, echo everybody else's, I am not a fan of charter schools either. But could you call the roll, please?
Charles,
Yes.
Wiper,
Yes.
Markham,
Yes.
Cavell,
Yes.
and Miller.
Yes.
We have 5 yeas, 0 nays.
Motion carries. Thank you, gentlemen.
Thank you. Thanks, Tracy.
Thank you.
We have no other regular agenda items. Any other business? Commissioner Charles.
Thank you. We had a couple reports that came by with regards to water and, just different stuff in that space. And I'm sure you very engaged human beings, commissioners, heard about the hacking of the water station plant down in Florida. And I think we are all very sensitive to water safety in our area. And so I was just wondering on the next committee, or perhaps not the next, but the one after that, if we would be able to have a little conversation with the water resource manager or commissioner, just to see what we're doing to circumvent and prevent anything such as that occurring. So that's all I had.
Yeah, that's a great idea. We'll set that up, and it might be a good idea to set up, if there's any other. So I know you had. I know IT doesn't report to this committee. It did last time, but it might be a good idea to have them just to answer the other questions about, the question you had for Leanne as well. So,
Yes,
we'll
Chairman Miller, I made a note to contact him over at IT to have him address the data security on vaccines and information. And then I'll contact the WRC to have him come and talk with you in regards to water safety and protocols for that.
Excellent. Thank you so much.
Thank you.
Any other business? Hearing none, we'll call the meeting closed at 11:04 in 37 seconds.
All right. Bye.
Thank you, guys.
Thank you.